Alcohol, cocaine, heroin, opiates. These are just a few of the harmful drugs that more than 9 million Americans are dependent on. Drug addiction is one of the most rampant diseases in the United States today, causing harmful behavior to the addict and those around them. In fact, statistics show this often relapsing brain disease is now more prevalent than coronary heart disease and stroke, and is as widespread as cancer. Medical experts say that people who often suffer from addiction also suffer from other psychiatric problems, which often contribute to the addiction.
The most common psychiatric problems that are associated with addiction include the mood disorders such as bipolar disorder and major depression, and other psychiatric disorders such as attention deficit hyperactivity disorder, some of the psychotic disorders, and personality disorders. Relapse rates are often high, in part because often these co-occurring psychiatric disorders are not recognized. People present for addiction treatment and the focus is on the addiction, but sometimes these other disorders are expressed in very subtle symptoms.
Addiction has long been considered a medical and neuropsychiatric illness because it changes the structure and function of the brain.
Addiction is actually a process in which a threshold is met where the brain has changed. So in the normal brain, where the mood is being regulated, behaviors are being inhibited, healthy, natural experiences like eating and having sex are providing rewards. All of this is changed in the person suffering from addiction. Now, obtaining the drug is the primary goal, and the drug or alcohol is the only experience that will provide that type of reward that the individual is driven to achieve.
Fortunately, treatments are available to help people counter addiction's powerful disruptive brain functions, which are most commonly complicated by other psychiatric problems. In Florida, the Wellington Retreat, a state-of-the-art addictions treatment center, is equipped with a rehab staff that can help recognize, diagnose, treat, and manage all aspects of an addiction so that sufferers are able to live productive lives.
We can help people who suffer from addiction in many ways, both biologically and psychosocially. By biologically, I mean that we now can use medicines to help with such experiences as craving. Psychosocial interventions include various types of psychotherapy which have been proven to be effective in treating addiction. For example, we use cognitive behavioral psychotherapy, which essentially helps individuals learn about their patterns of thinking and how it relates to behaviors, and to gradually change those patterns of thinking, which then lead to changes in behaviors. 12-step facilitation is another type of psychotherapy where we help an individual to recognize the principles of the 12-step program and how they may or may not apply to that individual's life.
I think the important thing that most people need to understand about addiction is that we're not talking about a disease concept or a disease model. We're really talking about a brain illness. We're really talking about a disorder of the reward system that's complex. And there are many factors that go into tipping the balance as to whether someone is going to fall victim to this or be susceptible to it. And it's really important to give a patient that has been suffering from addictive illness an opportunity to address each of those issues fully and completely in a way that really works for them.
Research has shown that individuals who need residential treatment, such as Wellington Retreat, or even intensive outpatient treatment, are more likely to succeed if they leave their familiar environment.
Well, for many people, a big step is just getting them away from the environment in which they're accustomed to using. Getting into a positive recovery environment is very important. Stepping into a residential treatment setting allows people to really get away from people, places, and things. In our residences, patients are really offered an opportunity to start working on their relationship with others. In the course of an active addiction, there are lots of negative behaviors that go on that really alienate family and friends. So this is an opportunity for people to start learning new or relearning old skills in relationships. How to negotiate problems, how to express your anger in a way that's appropriate, how to ask for help from a peer, And these are all skills that are really critical to recovery. So in our residences, we almost consider it a little bit of a learning lab.
The Wellington Retreat Center believes in evidence-based medicine that supports the use of psychiatric drugs to decrease cravings, help prevent relapse, and other benefits to the addiction sufferer.
There are a number of medicines that we use to treat psychiatric problems that can also decrease the likelihood that the individual suffering from addiction is going to relapse. So for example, in people who are suffering from a major depression and have been self-medicating, have been drawn to use cocaine and amphetamines, for example, to elevate their mood, if we treat the major depression effectively with antidepressants, they are less likely to be using the cocaine and amphetamines. We see that type of example with many other psychiatric disorders. And medicines that can treat the psychiatric disorders effectively can often decrease the drive that the individual is going to have to self-medicate with street drugs.
With a personalized treatment approach, the Wellington Retreat Center ensures that the recommended treatment plan is tailored to meet the individual needs of every client.
What we try to do is use the state-of-the-art assessment tools to really look at each area of a patient's life that's not working for them. For instance, on our staff we have trained addictionologists, physicians, neurologists, addiction specialists in psychiatry. We do a very complete assessment. We use a number of psychological tests to really help patients focus in on what their areas of need are and to identify the problems that really they need to address personally. We have an intensive staff-to-patient ratio that allows us the time to do that. And it's really not a one-size-fits-all when it comes to treating the disease of addiction.
I was an alcoholic. I was addicted to opiates. I had a horrible time getting off of opiates. I spent a lot of time in bed detoxing off of opiates, but the alcoholism was the one that I kept relapsing on continuously. I would get a couple of months sober and I just would have a relapse, and so I'd have to go back to treatment. It was very hard for me to quit drinking. The group therapy has been my healing ground that I attend here. The interaction, everyone here with their experience, everybody here contributes what they've been through. We all help each other. We're very supportive of each other. That's a big part of it.
To learn more about Wellington Retreat, please visit wellingtonretreat.com or call 877-WELLTREAT, a state-of-the-art addictions treatment center, a sanctuary for healing.